We're going to see the lesion of the fourth cranial nerve. We already talked about in the previous video that the nerve supplies the superior oblique muscle, and the actions of the superior oblique muscle are depression of the eye, abduction of the eye, and intorsion of the eye. But in order to test the superior oblique muscle function, we ask the patient to abduct the eye and then depress the eye. Now, when a patient presents with palsy of the fourth cranial nerve, we will see head tilting to the opposite side, and I'm going to demonstrate why this happens. Look, here we have a normal person looking straight and doing head tilting, so rotating the head towards the left side, something like this, or to the left, something like this. So here both eyes are looking straight and nothing is happening. When we turn the head to one side, let's say in this case we are doing this. So we are turning the head to the left side. So, and the eyes stick like this. So if we put like this, we turn the head like this, the eyes are going to compensate in doing the opposite thing. Now it is not just lateral gaze, it's intorsion and extorsion. Intorsion is from the 12 o'clock position, we put the eye over here, we have here the eye, we move it from the 12 o'clock position to the, let's say, 3 o'clock position, like this. This is intorsion, putting it the right eye, making it closer to the nose, and extorsion would be the other way around. We begin here at the 12 o'clock position and we turn it here, let's say, to the 9 o'clock position. This would be intorsion and extorsion of the right eye. Now, if we are turning the head to the left, then both eyes are going to do this movement. From the 12 o'clock position, they are going to move toward the right. So, like this. In this case, the left eye is doing intorsion, is looking through to the nose, and the right eye is doing extorsion. So this happens when we normally tilt the head to the left side, and the opposite would be if we tilt the head to the right side. Now, patients that present with cranial deficit of the fourth cranial nerve, they will have problem with the superior oblique muscle. Let's say that the patient has damage to the right cranial nerve 4. So because of this, in just straight vision, the eye would be a little bit abducted and looking upward. So it would be abducted and looking upward. Would be something like this. But we also lose the intorsion. So this eye would be in a extorsion position. So it would be like when it's trying to look, for example, downstairs or something like that. That is when the problems become more noticeable. The patient cannot look down because of the superior oblique muscle palsy, and the eye could not do intorsion. The right eye could not do intorsion, so it would be in a extorsion position. And in order to compensate this extorsion position, then the head is going to compensate. Remember that before, when we do head turning to the left, the right eye does extorsion. Now is the kind of the opposite. We begin with extorsion of the eye, and so the head compensates doing head turning to the left. and so the compensation would be intorsion of the other eye. So this is how the patient is going to present. If we just see straight, the patient will have the eye in a adopted and upward position of the eye, and when the patient is trying to, usually reading the newspaper or going downstairs, the patient will have loss of intorsion. So the right eye cannot do intorsion. We need to do intorsion in order to look down. We need that both eyes be like close to the nose when we are going downstairs or reading the newspaper. So in this case, because the right eye loses the intorsion, then the patient is going to compensate doing head tilting to the left side. And so this is why the patient presents with this peculiar position when he's going downstairs. I think that the most difficult part is to understand why the head tilts to that side, and I hope that this made clear with the intorsion and extorsion position. And if we think as the when we tilt the head to the left side, the right eye is in a extort position, and now we have a cranial nerve deficit of the fourth cranial nerve. The eye is in a extortion position, and so the head compensates doing the tingling to the left side.